Okay, now you are listening this video to understand anxiety. I mean worries. What is anxiety? In medical terms, anxiety is we call generally generalized anxiety disorder (GAD). Generalized anxiety disorder is the excessive worriness without having any reason. I will tell you the details. Why some people are more anxious, otherwise, why some people are prone to anxiety disorder as a psychiatric issue. That's because an imbalance between serotonin and GABA. GABA means gamma aminobutyric acid. The GABA and serotonin are two chemicals. Their balance remain as calm. When there is an imbalance between GABA and serotonin in the brain, what happens is that the patient become anxious. More than that, there are some genetic influence in the anxiety also. There are some families through which anxiety disorder is spreading. Suppose a patient do not have any genetic disorder, but the thing is that in their life, if there is any traumatic event or a stressful event, that may lead to anxiety in later life. Suppose there is no genetic susceptibility or life experience, still some personality, some personal trait who are excessively worried about something are prone to anxiety disorder. Now think about no genetics, no lifestyle, no personality, still some medical conditions like thyroid problems and heart problems make the patient anxious. Now, treatment are two ways using anxiolytic medications. What are the anxiolytic medication? Anxiolytic medications generally benzodiazepines. Out of the prototype of diazepam, you know the lorazepam, clozazepam, oxazepam, alprazolam, etc. used as anti-anxiety medications. More than that, you must know that it is not recommended during pregnancy and breastfeeding. Beyond this, I have to tell you one more tablet, one more drug, that is Buspirone. There is no sedation, no tolerance, and no dependence. That's a good tablet against anxiety disorder. One more thing I want to add is that during anxiety, the muscle tension will increase, impaired concentration will be there, autonomic arousal will be there, feeling of on the edge or restless behavior will be there. Also, insomnia, I mean lack of sleep, also associated with anxiety. Thank you.